so much, Bob. You know, by this point, you've probably heard of the hundreds of lung-related illnesses linked to vaping. There have even been some deaths. And now the American Heart Association says e-cigarettes are taking a toll on your heart health as well. We are joined now by Dr. Gul Dadlani, a pediatric cardiologist at Nemours Children's Hospital, and LaSonia Landry, Executive Director of the American Heart Association. Good morning to you both.
Good morning.
Thank you so much for being here.
Thank you for having us.
You know, I have to tell you, this is so disturbing because I remember about a year and a half, 2 years ago, my young son, 14 years old, he said, "Mom, my friend is vaping. I don't want to hang out with her anymore, but is it really that bad for you?" This was just 2 years ago where kids started vaping because they thought it's a cool thing to do, it's not going to hurt you. We have completely learned otherwise over the last couple of years. Tell me a little bit more about that.
Yeah, vaping's an epidemic in our community and across the United States. When you look at it, if you have a child in high school, middle school, or even elementary school, be concerned about it because it's everywhere. When you vape, you inhale these ultrafine particles. They can cause inflammation in the lungs and have led to, over 2,000 admissions in the United States and 47 deaths in the United States in the last year. So.
Before we get into the results of these findings, I do need to ask you, what is so much more dangerous and so much more quickly dangerous about vaping than smoking cigarettes?
I think it's the access that kids have.
The excess, really?
When you look at it, many of the vaping products have been flavored specifically to tailor them towards adolescents and young adults. With that, there's over 15,000 different flavors that you can choose from for vaping products. And when you look at that, many teenagers and young adults have then gone on to add THC, one of the products in marijuana, to that as well.
So tell me about the findings then, in terms of now we know that it affected the lungs, but now we're talking about the heart as well.
Right. One thing that I want to point out, something you said about 2 years ago with your son, what's really startling is just 2 years ago, 1 in 10 students were using e-cigarettes or vaping, and today our data shows that 1 in 4 students are using e-cigarettes or vaping. So just that alone, we know it's a huge issue. When it comes specifically to the heart, I'm sure Dr. Dadlani could tell us some.
So the American Heart Association 2 weeks ago at their scientific sessions in Philadelphia released data that showed that vaping and e-cigarettes have been linked to markers of chronic heart risk. So they showed that vaping can cause increase in your cholesterol and decreased blood perfusion to the heart muscle itself. Both of those can cause you to have an increased risk of having a heart attack later on in life with that. So vaping can cause acute injuries to the lung and long-term issues to the heart. So it is not a benign thing to do.
How startling is it when you hear something like this?
You know, it absolutely blows my mind, and I think about some of the things that the American Heart Association is doing to combat this. Dr. Dadlani mentioned all of the flavors. We support legislation to ban all flavored e-cigarettes and vaping, and we also support legislation to raise the minimum sales age to 21 because of those statistics and how startling it is.
And doctor, what about you? Surprised? And I know, being a doctor, you see a lot, and you see a lot every day, but this to me seems to be an epidemic.
It really is, and I think if you have a child and they start to have a cough, shortness of breath, chest pain, nausea, vomiting, or weight loss, you should be concerned, are they vaping at home?
And by the way, I need to add this very quickly. Sometimes parents don't know because it's odorless, right? So you may not even know if your child is vaping. And so I do want to get into really quickly having a conversation with your child, right? Maybe even beforehand, or just make sure that you're on top of them and asking those questions.
Yeah, I'm sorry.
No, please.
We've been working really closely with all of the local school districts to make sure that we can help parents have those conversations. So providing them with resources and education that they can have. They're tough conversations, right? But they're conversations that need to be had. We know that in Orange County, vaping has become the #1 offense for all students in Orange County. So this is not something that we should shy away from. It's something we should be having an open conversation about.
Well, absolutely. And I appreciate you all coming and starting that dialogue. Thank you so much
for having us today.
Great information. We appreciate you. Thank you. Boy.